When you were growing up at nighttime, did a parent, or especially a grandparent, come in and say goodnight, but they'd say something like, "Good night, sleep tight, and don't let the bed bugs bite"? What does that even mean? That's what today's video is on. Bed bugs. What do they look like? How do you identify them? And if you get bit, how do you treat the bites? And finally, a little bit about how to get rid of bed bugs if you find them in your home. Hi, I'm Dr. Brian. So bed bugs are small bugs that don't fly, and they're found all over the world. There's a lot of different species. There's one known as Cimex lectularius that is responsible for the majority of bed bug infestations if you live in moderate climate. Bed bugs can live in hotels, houses, and basically anywhere people can rest and sleep. And they can live in mattresses, clothes, walls, and all other parts of your home. And most often, they bite you when you're not looking, when you're sleeping, resting, and at night. If you have bed bugs in your home, you might not see them because they're really small and they hide during the day. They're typically oval shaped and flat, and that allows them to hide in really small crevices and cracks. Adult bed bugs are about the size of an apple seed, approximately 5 to 7 millimeters in length. They're reddish brown in color, and after feeding, which by the way is on your blood, their bodies swell up and they become brighter red. Baby bed bugs or nymphs are quite a bit smaller. They're translucent, kind of see-through, whitish yellow in color, and they're really hard to see unless you have a magnifying glass. Identifying a bed bug infestation can be a challenge because they're nocturnal, meaning they only come out at night, and they're really good at hiding. They go into tiny crevices, tiny cracks. They go in mattresses, cushions, bed frames. They can be found in the folds of curtains, behind loose wallpaper, under peeling paint, or in baseboards. But the common signs of bed bugs include the following. Number one, which are bite marks. Small, red, itchy bites on the skin, often in a line or a cluster. You can have blood stains, tiny little blood stains on your bed sheets, mattress, or pillowcases. You also have little dark spots or rusty spots on the mattresses, the bedding, and the walls, which are actually bug poop. Regularly see little yellow skin and eggshells around your bed. And if you have a really bad infestation of bed bugs, it can actually give a musty, sort of sweet smell. Identifying a bed bug infestation, like I said, can be a real challenge because they only come out at night and they're really good at hiding. So what do bed bug bites look like? Can be very distressful and causing discomfort. But the good news is they're not known to transmit any diseases. The bites often appear as small red welts. They're typically arranged in a line or a cluster, and they're commonly referred to as breakfast, lunch, and dinner bites. They're on parts of the body not usually covered by clothes, such as your face, your neck, your arms, and your hands. They can be really itchy, pink, kind of skin colored, or they can be brown, purple, or red, depending on your skin tone. Most people don't feel it when they get bitten, and they might only notice the bites in the morning or even after a day or two. Now, bedbug bites can take 3 to 6 weeks to heal on their own. And if you really scratch them, they can actually get infected, which can be the worst part. Sometimes after a bite heals, it leaves a dark spot on the skin. This usually goes away, but it can take a while. The reality is bedbug bites are usually very harmless, but there's a real small percentage of people who can actually experience a more severe reaction, such as intense itching, hives, or even what's known as anaphylaxis. That's where your throat swells, your tongue swells, you can't breathe, and it requires emergent treatment. Think EpiPen. So how do you treat bedbug bites? Well, they're really pretty easily treated, and over-the-counter medications can be used if you need them. And here's a couple steps to alleviate the discomfort. First, clean the area. Wash the bites with soap and water. That's gonna help prevent infection and reduce the itchiness. Then you can get a simple anti-itch cream, calamine lotion, or something that contains pramoxine, Sarna, Aveeno anti-itch, or even Neutrogena skin aid. All of these can really be helpful. Or you can get over-the-counter hydrocortisone. If that just doesn't do it, you can also take oral antihistamine for the itching, which is usually Benadryl, although be careful because that can also make you sleepy. Some people find ice packs helpful if you put it on the areas of itching, and try and avoid scratching the spot because scratching the bites can lead to infection and prolong the healing and leave permanent marks. Try and keep your fingernails short and clean to minimize the risk. So if you've identified you have bites and you have bed bugs, how do you get rid of it? Well, if you get on the internet, there's all sorts of kind of goofy things that they say you can do at your own home to get rid of bed bugs. The reality is bed bugs can be really tough to get rid of because of where they hide and how they hide. Just because you can't see them doesn't mean that they're not there. If you hire experienced pest management professional, especially in your area, they'll know what to do. There are some techniques that include insecticide that you have to be careful with. Obviously that has some risks, and bed bugs can be really resistant to just one insecticide, so sometimes they have to use multiple. There's also some heat treatments, there's some cold treatments, but really recommend that you get a professional to help you get your house clear of the bed bugs. That's bed bugs. More than you probably wanted to know. If you like this video, please don't forget to hit subscribe.